Okay, so in the first two segments we have been talking about stomach problems and endoscopy of the upper digestive system. Just wanted to mention briefly some information about colonoscopy or endoscopy of the colon. Colon cancer is certainly a growing concern. It probably is overall the third most common cancer that we see in men, and it's probably about the third commonest also in women. And like all cancers, we want to pick them up early so we can treat them. But in the case of colon cancer, we have a similar advantage to cervical cancer in that you can actually find the problem before it becomes a cancer. And that's what colonoscopy is aiming at, to pick up what we call the pre-malignant lesion, which is a polyp. That is something that over years left alone can become a colon cancer. So if we can pick it up at the early stage, then we can prevent colon cancer. Similar to how the gynecologist would use the pap smear to pick up the early stages of changes in the neck of the womb before it becomes a cervical cancer. So for all patients over the age of 50, it is recommended, whether or not you're having any problems with the bowels, that you actually have a colonoscopy done to examine the lining of the colon to see if you have any of these polyps that could become a colon cancer in the future. And if you have one done at age 50 and it's perfectly normal, then you don't have to do another one for at least another 10 years. However, we also will find patients who have symptoms that may suggest that they might have already progressed to colon cancer. And colonoscopy is also valuable in that situation as well, to determine first of all if there is a colon cancer, to tell us where exactly in the colon it is, and whether or not it's one or more than one of these growths that they have in the colon. And in terms of symptoms that might suggest to you that you should have a colonoscopy done to find out if you have colon cancer, include any form of bleeding from the back passage. If you go to the toilet and you see blood in the stool, or blood when you wipe, or blood in the water, then you need to consult your doctor and find out whether or not this needs to be investigated by colonoscopy. There are, of course, other possible causes, but we need to worry about colon cancer, especially in patients over the age of 40. Another symptom that might raise issues is a change in your bowel regularity. So say for instance, you find that you normally go to the toilet every day, and you find it's now becoming more difficult every 3 days, especially if you have slowness of the bowel or constipation, and then on the other hand you have looseness of the bowel or diarrhea. And that sort of alternating bowel pattern certainly is one of the possible indications that there might be colon cancer. Another possibility would be anemia, where you find that you not have as much energy as before. Doctor does a blood test and finds that you're anemic and says it's because you're lacking in iron. One of the possibilities again is colon cancer. And finally, you have to consider the family history. If some member of the family, could be mother, father, one of their direct relatives, or a brother or sister, has had colon cancer, especially if they have had it before they've been diagnosed, before they got to the age of 50, then that might indicate that other family members are at risk for developing colon cancer. And in those cases, it's a good idea to get screened, as we call it, when you don't have symptoms and we're doing the colonoscopy, to have a screening colonoscopy done before the age of 50, and ideally several years before the age of the person who was affected, the age when they were diagnosed, to get yourself screened for colon cancer. So what we have discussed today is what we call gastrointestinal endoscopy, or looking on the inside of the digestive system at the upper end, which we call upper GI endoscopy, or the lower end, which we call colonoscopy, or looking at the colon. These procedures are available at Royal Medical Center, the hospital and clinic, and they can either be booked directly with the receptionist, or your doctor may see you and decide that they want one of these procedures done, and they might refer you to the center to have either procedure done. When you get to the receptionist, they'll be able to give you an idea of the times when these procedures can be done. They have valuable information pamphlets to give you to educate you more about the procedure, and they can also inform you about the cost. So I'm Dr. John McRae. I'm a consultant general surgeon at the Royal Medical Center, and I'm also an endoscopist. I do endoscopy of the upper and lower intestinal system. Thanks for joining us today on our program, and keep watching What's Up Doc.